So a huge, huge welcome to our Playbook series of Doctorpreneurs here from Entrepreneur Spark Plug Hub. And I'm truly excited to bring to you today a doctor from our very own glittering city of Dubai, Dr. Shekhar Mehta. And we are really, really honored to have him. Here, what we're trying to do through these podcasts we're trying to build a community of doctorpreneurs for doctors, for medical students, for individuals interested in healthcare, innovation, and entrepreneurship. So today, really, we would like to really welcome Dr. Shekhar Mehta. It's a pleasure to have you here.
Thank
Uh,
you. Thank you.
yeah, and for those of you who do not know Dr. Shekhar Mehta, he is a long-standing doctor in a career of general practitioner. He's an ex-Indian Navy medical doctor. He's had several management positions attached to big hospitals. And guess what? He is an MBA from Manchester Business School, UK. I mean, how many doctors have that? So absolutely a serial entrepreneur. And right now he has his home care service called the Healthserve, which I'm very close to, which is very close to my heart because Dr. Shekhar and I have worked together on that. And we've had the opportunity to add value to each other. So really, Dr. Shekhar, thank you very much for joining us here.
Thank you so much, Priscilla. I mean, that's so kind of you to have me for this session. And I really appreciate our stint, what we had together at Healthserve. So thank you. Thank you for having me. I'm
Yeah.
really excited to talk to you today.
Thank you. And so are our viewers and our doctors who are watching this. So for whether it is for solo practices or whether we are talking about large groups or we're talking about commission models for doctors, medical practices, the challenges are really great, right? So I have to tell you that certainly the challenges come in terms of dealing with staff issues, rentals, equipment, administrative burdens. I mean, regulatory challenges, costs of, constantly evolving technology. You try to get one technology and then something else comes up already. Shifting trends of consumers, all in the face of you know, more competition, frankly. And of course, the funding challenges that people face. So, in that situation, in all of this, I just want to really you to give our viewers a heads up on how did you get started with your business? What was it like for you and when you started your business?
Correct. See, I'll give a small little introduction of how I started in Dubai. So after my Navy tenure, I did my MBA from Manchester School, Business School. That was almost 15, 16 years back. And that is when I decided to come to this beautiful city and this country, where I've been here for now almost 15, 16 years, just after my UK tenure. So having said that, working as a general practitioner, medical specialist, and then MBA, somehow, my personality has been always like kind of leadership, kind of roles I have been looking on to since my school days and college days. So Navy gave me an advantage and it opened my minds to a couple of other things. So being practicing as a doctor was not the only thing what I wanted from my life. So I thought that why not to take it and give a bit of, attain a bit of technical training onto the management side and running kind of business for the same in healthcare industry. So that is where I took my technical training, and I have been into a couple of managerial and C-level positions in Dubai. I started my career in 2006, almost in Dubai, as a projects manager for a 100-bedded hospital. So that was my first role with a very big group at that time. And yes, since then I have had a couple of positions in different various big healthcare groups. During those stints at these groups, I realized that, yes, I do, and I'm very happy practicing as a doctor. So I still have my license. I still do see patients. But at the same time, I thought that, I could make much more difference to people and their lives uh, by having a kind of business model, which is, started for two of three of my personal situations. One of them is my sister. She had meningitis when she was 2 months old. That was almost 40 years back, and because of which her entire development got delayed. So we have a child, my sister, who has to be taken care by my parents, even though they are old now. And me and my brother, both of us live outside the countries. So that gave me an idea that, we should have something wherein healthcare professionals could reach out to the patients and their families for these kind of patients and help them out for the same, rather than, every time patient coming to the hospital, for which there are a lot of things where many of the times they don't even require to come to the hospital. But yes, they do require medical attention. So frankly speaking, that was the thought, and because of that, my passion, I had more and more developed. I started learning more about home care, and that is where I started this business almost 7 years ago, into home-based care, wherein we go and treat the patients at their homes. So that is how it gave me an idea to do that.
Oh, this is so beautiful. I understand this purpose and the passion that runs with
Right.
Healthserve, and that you take care of all your patients and the nurses. And it's not an easy task to
Absolutely.
to do this. This is, in fact, this is even more of a difficult task than doing a normal medical practice, I would say.
Absolutely, absolutely. Because how we are different is that in the hospital there is just one patient. At the homes of the people, it is one patient and 20 family members around that person. So they will have their own opinions and the way how to treat a patient. So yes, it is difficult. But the other thing related to this, how I got this idea is that in India, I belong to India. A lot of that there was an age-old concept which was called as ghar ka doctor. So any small thing which means that the doctor who's very near to you, the entire family members, they are being treated by that general practitioners. Any other problem, if they have, they can be seen or referred to specialists. So that is what we want to become, and that is one of our visions, that we are near to the patients. Any problems they have, any basic issues they have, they want to talk to us. They want advice on healthcare specialist referrals, or if there is anything where they want to know about healthcare, that is where we come in picture, because we are connected on a day-to-day basis with. So that was one of the one other reason why we got into this, so that we are like doctor at very near proximity to you, wherever and whenever you want.
Yeah. And this is such a, is this covered by the insurance for the home care part?
Right. So some of the policies, if we talk about UAE, it is covered by some of the premium policies, but many of the insurances unfortunately do not cover some of the services, long-term chronic services under this. But in India and US, UK, and Western countries, this has been there for quite a long time. So a lot of other countries where it is already developed, there are a couple of insurances which definitely do cover.
Yeah.
Yeah.
In India, it's such a big trend. Like,
Oh yes, oh yes.
it's a big trend to have this home care stuff, because everybody's working. Even if they're not working, you still need help. I mean, I know personally, my quite a few of family members have this thing, and it's such a blessing, frankly.
Correct.
It's such a,
Absolutely. And virtually in India, you can set up an ICU, in fact, with the team of doctors, nurses,
ah,
ventilators, everything at your home. So somebody who can afford, obviously it comes with a premium price, but somebody who can afford, and couple of advantages of home care, since we are talking about home care, is that these patients, some of them might be on ventilators, somebody with a tracheostomy or peg tube, who require nursing and medical care, but not necessarily in the hospital. Because if you are admitted in a hospital, you have more chances of getting infection. You can be at your home and you can be treated there by our healthcare professional. That's why
ah,
home care is taking much more, and people are starting to have more and more, their relatives who require these care to be treated at the home and looked
This is
after.
Yeah, and this is, I think this is such a beautiful thing that you're doing, because I always have been telling doctors, or any, mainly doctors, is that they should have a multiple stream of income. There is always good to have another, whether you're selling pathology thing, or whether you're selling equipments or products. And
Correct.
this service of home care is something so good. So just so for benefit of everyone, all our viewers, just to understand, what have been the toughest hurdles for you to overcome when you started on this? So have you been in this for 5 years, or how many years now?
Almost 7 years now. We are going to finish.
8. Yeah. So what were your initial hurdles that you've had to face? I
Right.
do know some, but I would like to hear from you.
Sure, sure. See, having been here in UAE for a long time and starting a new business, I mean, there are a lot of advantages and a few challenges, what I would like to put it as. Advantages, yes, it's very easy to start a business. You take up a license, government is very supportive. You get quickly the licenses, approvals, if you have all the documents in place. So that way, it is very good to start a business. But then, anywhere, to start such a little bit different kind of business, our main challenges at that time, which I faced, were, finding the right manpower, because there are certain types of regulations, because it is a new field. So there are a lot of gray areas wherein, there is a lot of things to be done and written and streamlined. So at that time when I started, home care was relatively a new concept. Now in UAE, we have more than almost 250 to 300 home cares in such a small country.
Wow,
Just for
really?
your information. Yes,
Oh my
yes.
God. Oh, we didn't know that. Okay.
So um, regulations, yes, is one thing wherein which some of the laws were not clear at that time when I started. The other thing was to find the right manpower and right team and skilled professionals to provide those services, healthcare services. Because people usually think that, okay, you just, it's similar kind of providing maids. It's not maids. Our healthcare professionals are licensed professionals. They have various certifications. We give them in-house trainings. That is where we put them. So manpower was another issue. Funding was not that big an issue for me at that time. So because we started small and then we gradually scaled up to
And y'all
the
grew pretty
current number.
fast. Y'all grew pretty fast.
Well, I started this with one single nurse. Now we are 80 plus people. So
Yeah.
yeah, some things could be right with that.
Yeah, yeah, yeah. It's real. And I know how it is to get nurses from anywhere in the world, and then,
And
manage
make
it.
them work in home care, because many of these healthcare professionals, in fact most of them, their first choice by default is hospital, then clinic, then home care. What they don't realize, it is for other viewers, if they are listening to this, especially the nurses and all, that it is a different kind of industry. It's not necessarily, because in hospital you might have 10, 15, 20 patients, and you are their team of nurses looking after those patients. Here, it's just one single patient you have to take care of during your duty. There are a lot of advantages also what they get, because work-wise, it's not relatively that much hard or so as compared to working in a hospital in night shifts, rotation, and so on. And at the same time, it's just one patient. You need to take care of the same. And this is the industry which has got a lot of future potential, because now everything is at your doorstep. You want a
Yes,
visa right now. You want
yes,
healthcare. You want doctor right now. So, okay, fine. So if you
yeah.
get into this industry at this stage, probably you will have a long or, good career prospects as well,
Yeah.
having
And you've
worked in
got to
this.
really be very good with people. And actually, doctors
Absolutely.
business has to be good with people, isn't it? There's no other way.
There's
There's
no other choice. I mean,
there's no choice. You've got to have. So, like you said, the main challenge is, the first thing I would just like to wrap up in few things for our viewers' benefit is that you really connect with this business because you've had a sister who really needed
yeah,
care and attention at home. And so it's very important to have that sense of purpose when you're really starting any business,
absolutely.
not just
Absolutely.
having to start because it's going to make money. Second part is, yes, it's challenging. in your case, the funding was you just probably used what you had and it was on a small scale, which
Yeah,
is also a good way to start. And the challenges of any medical practice is about hiring the right people, the people who
absolutely.
really correlate and gel with your mindset. It's
Correct.
so difficult. I spoke to a doctor and he said, Priscilla, I had to infect my mindset on the people around me, and they became
Correct.
infectious with me and my mindset, and then they came into my business.
Correct.
So,
Correct.
so it's so important to have these things and also to know the regulations. So these are the few things that we really need to summarize. Now,
Yep.
if I had to ask you, doctor, you just said about the team, right? So,
Yeah.
I mean, how do you literally strategize on building your team in terms of, let's say, recruitment, training, you said, and giving them a good, what do you say, work environment? What are your strategies in some of these cases?
Right. So, over a period of time, we have had our share of setbacks. We faced a couple of times, wherein we got into situations that we were not able to hire right people because of, people not having interest to work in home care. So, couple of things what we did were, you know, one was obviously salary levels, what they get in normal clinics or hospitals. Obviously, this is different scale than what do they get in there. So that was one financial incentive what we had, and the other was, the policies what we made related to their transportations, so that they feel that like pick up and drop from their place, and talking to the customers and their families, making sure that they get proper, let's say if somebody is doing a 24-hour shift there, so we make sure our nursing team, our clinical team goes there. They make sure that and check that where the nurse will sleep, what she will eat, what is the food kind of thing, is she has a separate place to take a bath and do the daily rituals. So we do go down to that level, so that they are comfortable. If they are not comfortable, we will not be comfortable, first of all. And the safety and all also is important to check that part as well,
Yeah. It's
um,
so,
because they
yeah.
are living in other people's houses. Yeah.
Absolutely. And
This
also,
is
they also connect with the culture that you have in Healthserve. I mean,
exactly
with you, you have your regular meetings together with them.
correct.
You push to them what are the value system that you hold in Healthserve, what are the rules
Absolutely.
and to do's and don'ts. And that
Absolutely.
also, I think, because I know your team personally, I know
Correct.
that that really has helped in giving good support to home care. And I'm really passionate about that aspect
Absolutely.
of your of Healthserve. So having understood that, so that's a great job well done on team aspect of it. So
Thank
you've got a
you.
policy for hiring because it's a continuous hiring thing that you do because it's churning and as you're growing, you have a policy for their welfare and benefits. You have
Absolutely.
training systems. So all that
And
works.
one more thing I'd like to add, we have levels of this thing. So let's say, we have caregivers or nurses taking care of the patients there. So then we have a team leader who takes care of these three, four people. So if they require certain support, that person goes or monitors if they have any difficulty clinically or, any other problem if the staff has. Then we have patients relations coordinator, then we have nursing manager, and then we have a HR. So we have developed a kind of system wherein it filters through various levels, and then they can escalate their problem if at all they have, which includes the patients also and the staff as well. So we
Yeah,
get to know about both
yeah,
the sides of it.
yeah. Yeah, that's so important. And doctor, if we had to say, I mean, I just want to know for you to be on top of something like this, do you have some role models or mentors that you followed from the beginning? What aspired you or inspired you?
Well, role models, I don't generally, in my industry, obviously, there are a couple of people who are from the groups. And, some of my ex-bosses also have been my role models
Yeah,
in that senses. Yeah.
yeah, that's
But at the same time, I do take my inspiration from small, small things. And in fact, patients, their conditions, and how do we treat them as colleagues, I mean, my different colleagues, that is where I take most of my inspiration from.
Yeah.
So I would not have any specific role model, but I take bits and pieces from the people whom I meet on a regular basis, and not necessarily the healthcare, mentors or like.
Yeah, yeah.
So
Oh, yeah.
yeah,
That's so good. One thing that I saw heard in one of the interviews that the doctor said was, for me, sitting in my clinic and taking care of 200 patients in a day is the positive thing. I heal myself through that. So,
correct,
so
correct, correct, correct.
it's the same thing. I think it's a common thread with all doctors in that.
Absolutely, absolutely. And doctors, they have been trained to be individualistic, and they have a very patient-centric approach that my patient has to get ready. I don't care about rules and regulations. Sometimes
Yeah,
doctors might
yeah,
think they don't
yeah.
believe in systems and process. So they have been trained like this to take care of the patient, get him all right. And for me, being on both the sides of this healthcare and running healthcare as a business, I've seen these transformations in me happening. When I sit as a doctor, I only care about the patient's well-being. And these are small, like little projects for any doctor. One patient is one project. You do it, you feel happy if
Oh,
the patient is happy.
oh yeah.
And that kind of satisfaction you can get only as a doctor.
Oh,
As a manager or as a business owner, I feel that the system processes, if they are in place, and if going through that system, the patient or the ultimate client is happy, then I feel happy with that.
yeah. It's so beautiful. I think that's where that's the difference between the doctorpreneur and the normal entrepreneur. Okay,
Docpreneur for me.
docpreneur. You call it docpreneur.
I
Yeah,
call it
that
as
is Dr.
docpreneur.
Shekhar's brand. He calls himself docpreneur. That's nice. And I call it doctorpreneur. So okay, we didn't know
Yeah,
it.
I am.
That's,
Yeah,
yeah,
right.
that's
What you said is absolutely right. In terms of, and in fact, my master's thesis was uh, how do doctors behave, or something like it was actually 15 years back. Then doctors as as managers, when they get into management part of this, some of them, they realize, oh shit, I did not do good, I did not take a good decision, because medicine was no responsibility in that sense. I had to treat
yeah.
my patient and that's it. But as overall business owner, or managing that business, you are responsible for the entire thing. So many of the doctors, they don't feel happy when they join management or a business position. They don't
Absolutely.
understand numbers and statistics. That is what happens with a lot of doctors who
Oh
come
my
into
God. And
management.
this was my next question to you because you
Correctly.
have been on this. It's not
Correct.
taught in your medical school how
No.
to hire people, how to set up
Correct.
a business, because
Correct.
it's your, as doctors, you're so much on patients' health. Sometimes it's even
Absolutely.
not taught about how to respond, emotional intelligence,
Correct.
with your team, how to do. So it's a big challenge for doctors when it comes to emotional intelligence, numbers, getting marketing and sales. That's the biggest thing,
Absolutely.
right? So yeah,
Absolutely.
so in your opinion, do doctors really need, now doctors are usually specialists. Do doctors really need to be a good generalist in this entrepreneurial line? Do you think they should learn all of this?
I will tell you a small incident. When we were in medical college, one of our PSM teacher, preventive and social medicine professor, he had a very good line. What he used to tell us, that doctors are the most illiterates amongst the literates, because doctors don't get time to do and look at anything else. Their general knowledge, their other knowledges, marketing, sales, nothing they know about this subject. That's what he used to tell us, that most illiterates amongst the literates. So having said that, yes, because the thing is that the doctors have a very long tenure of studies, and we still have to update ourselves for medical treatments, innovations, etc., etc. But somebody, I mean, that's would be my advice for people who would like to get into entrepreneurship or into business management of healthcare, would be that you have to have a kind of training for the same, because without that you will never understand marketing, sales, business development, finance, which is very important to run any kind of business, and which we are, as doctors, we are never being taught in medical schools. In fact, communication skills is one of the things nowadays they have inculcated in the
medical school.
curriculum, MBBS curriculum also, because a lot of doctors knew how to treat, but they did not have good communication skills to talk to patients. The first and the foremost thing is how you deal with your patient. A lot of these softer skills or hard technical business related skills, also some kind of training.
Absolutely.
So yeah.
Yeah, you're so right. So definitely they got to learn the various skills and get into it. And that's why I would like to just pitch in for those who are listening here. If we have got an profit automation system for doctors to have a continuous cash flow and lead flow of customers so that you really don't fall down on customers' demands or your patients' demands, which are really unrealistic sometimes, or even at the hands of insurance or anyone, which if you have enough customers, you are the king. So that is what is our Business Builders Masterclass, which is happening in this month in November. And I'm going to tell you a little bit more about it. It's having basically a 90-minute session for doctors, and we'll talk that towards the end. So this is in context with Dr. Shekhar, where he said that doctors should learn communication, doctors should learn marketing and sales and how to be leaders, leadership and team. If you do not learn this and just start, it's going to take you years to really reach your
Absolutely, absolutely.
dream.
And to add on to that, for the viewers, we had a great, kind of training from Priscilla. I mean, I have to add that thing. And a lot of things, our team learned and related to business aspects. So the point here is that you need to have professional training for the same, however and whatever ways you can do it. But because otherwise, a lot of things would be really difficult if you will not be able to understand how the business works, overall business model works, understanding of finances, teams, HR related stuff, which I think with Priscilla, we had a great, kind of association.
Yeah. And Doctor, I just want to ask you, so today when we're talking about for this entrepreneurs for doctors,
Mm.
with you being here since 2006 and associated on management and in patient care, both sides, what do you think are the 5 crucial tips that you want to give to these medic students and doctors who are still not able to make it? What, sometimes some of the doctors are not even getting fair salaries, but they have got
Absolutely.
obligations. So I am thinking that they can come out of this challenge. So what is your 5 tips, if you could give them, if that comes to your head?
Correct. So I would, generalize a few of the things which I face in my it's not a transformation. I still do practice. I mean, as a doctor, but getting from medicine to running a business by yourself. So a couple of things which are very important nowadays is that one, what we already spoke about, which is that get some kind of professional training before you start or hop onto something, which you
True.
might during that training might find that, okay, I don't understand numbers. So then business is not for you. If you don't understand numbers, then why? First of all.
Like my coach, when I, sorry to interrupt, that is the first tip. But when my coach, I said to him, I'm HR, I
Exactly.
don't know how to do marketing and sales and digital.
Exactly.
He said, if you do not know digital and you do not know marketing, you are screwed. Shut your.
Absolutely.
So you
Exactly.
have to learn what you have to
And you
learn.
don't want to learn, so then it is not for you. So you
Yeah,
have to have that passion. At least, okay, you might not know it, but you have to learn all these things, because these are mandatory to run any kind of business. So the second point related to this, which I would stress upon, is social media and digital marketing. I learned during these my 15 years digital media. I still don't understand many of the things. Social media, Facebook, Insta, these are very important, especially for our kind of business. It is definitely mandatory to have your presence felt all across, all channels of whatever and wherever you can on social media. You have to be there. You cannot avoid. So you will have to learn how Facebook ads work, how Google ad works, how Insta ad works and all. And we all are learning. I'm still learning for sure. But you have to hire right team of people. But if you will not understand what they are trying to say, you will not be able to
Well
focus
said.
and put money also if required
Yes,
there.
yes, yes.
Then I think you know, there has to be a personalized touch, which I think doctors might be able to give because they have been people's persons throughout their
Absolutely.
life. They are dealing with people. So you have to get involved in that business. It's not like that you arrange for money, you hire a team of people and they will work for you. It will not work like that. Even if you have got money, but you will have to get yourself involved in the day-to-day business. So you will have to have a personalized. Other thing which I would like to stress upon is innovations and technology, which is very, very much essential for any kind of business nowadays. Everything is through the app. Like many of the businesses run through only apps and they what they create like Talabat and all deliveries and etc. So you will have to understand technology, and in medical related, medical field, there are a lot of things. So virtually, as a doctor, I can, decide the dose of insulin which your pump at somebody's patient at house will titrate the dose and automatically gives it away. So
Wow.
I don't have to send a doctor or a nurse to do that. From here,
Oh,
I can titrate the dose. So
yeah.
you will have to understand technology. A lot of doctors I've seen, they are very resistant, especially the electronic medical records and all. They don't want to enter even
Oh,
into the system.
yeah,
A generation just before me, even we started learning about computers when I was
yeah,
passing my college. What is computer? What is email?
yeah,
So they have to learn technology and imbibe into their culture, day-to-day thing. So then your lives will be much more easier in terms of business and in terms of your clinical practice.
yeah.
And the regulatory thing, obviously, if you're starting a business, you have to know the law of the land, and plan and grow your business as per the regulations of the land.
So, are the different Emirates have different regulations for doctors to open up a business?
Yeah, so this is very interesting. I was about to touch in some point of my discussion. See, in UAE, if you talk about specifically, it is about less than 10 million population. Still, there are four regulatory bodies as of now. So for Dubai, there is Dubai Health Authority, there is
Yes.
MOHs for Northern Emirates. Then in Dubai also there is Dubai Healthcare City, and then there is DOH, which is for Alain and Abu Dhabi. So
Okay.
there are different regulatory bodies, but this is how the system works. So if you want to practice or start a business here in any of the Emirates, the laws and regulation might not be the same as what you want to do in other Emirates. So as I said, you have to learn and know about that.
Have to be, yeah. You have to be very well versed with these. So
Absolutely. In fact,
these
the
are,
professional licenses also are different for these regulatory bodies,
yeah. Oh, okay. Professional license itself are different for them.
which
Okay.
means a person who has MOH license and practice in Ras Al Khaimah cannot come and directly do a surgery or practice here in Dubai. You'll have to have a
Oh,
separate license and so on for Abu Dhabi.
oh, I see.
Yeah.
Okay. Oh, so they're restricted by regions then
Oh yeah.
also. So that's very interesting because when they are doing their ads and Facebook and all that,
Exactly.
it really relates to all that. Yeah.
Absolutely.
Okay. So the 5 tips by Dr. Shekhar for before you start is first is get professional help, really understand the nuts and bolts of a business, all aspects of it, like it would be in any of the businesses while running, practical tools and implementations. Second is to learn your marketing techniques and tools, which is your social media or SEOs or Google Ads and all of those aspects. Third is you have got to be very people oriented, very empathizing, understanding, soft, and caring towards which comes
And
naturally to
just
doctors.
one more thing, Priscilla, I will add to
Yeah,
this is clinical quality, which is very essential. That, a lot of healthcare groups, they forget what they are there for. You can create a five-star hospital, but if the clinical quality, people go to hospitals for doctors, their treatment, right? To get treated. if you have the most fanciest hospital, most fanciest clinic, you don't focus on clinical quality, and if the people don't get well, why will?
Oh, yeah.
So you have to get
You
that.
have to have that clinical qualities.
Yeah.
Absolutely. Clinical qualities, you got to be listening and watching out for innovation and technologies. And the fifth
Finance,
one,
understand finance,
understand the finance. Yeah.
investment, finance.
Yeah, investments, finance, and how your P&L and balance sheet should look like. Simple things, to operational
Correct.
costs, how you can really look at those numbers to get your margins up. And of course, know your regulatory systems in terms of whichever emirate you're planning to practice. Find out what are the regulations and get bang on to that. I have a one question last, Dr. Shekhar. What is
Hmm.
your vision for you 10 years from now or 5 years from now?
See, there are a couple of things. One is, as I said, that we want to really, really focus on our clinical quality. Again, two, three of these points would be repeated because, yes, we are building up a team. If I were to talk about my organization, so we are planning to hire and have more in-house trainings so that our people, when they go outside, they are very well equipped to treat or take care of any kind of patient. And being very specific, which is required for what, let's say for newborn. So we have trainings for newborn care and so on. Let's say for elderly or geriatric care, we have people who are trained for that kind of care and so forth.
Yeah, yeah.
Other thing, which, as I said, that technology, we are planning to get into lot of things and utilize technology in the right way. So we have, we are planning to give iPads to our caregivers and nurses so that they can put the entire records, medical records, everything from that end, and we can get it digitalized in the digital format. And the same goes for medicines or some kind of, teleconsultations and so on. So usage of technology and innovations in our field is our next immediate agenda, and we would like to utilize as much as possible in our. The other thing, what I would say is that for us, uh, there is one more thing. I mean, my younger brother, he's an engineer. He works in UK, so he is into design management and so on. Artificial intelligence, a lot of the new concepts, so which the entire world keeps on talking about. We are planning to get into some kind of architectural forms and all, and especially for the people who are at home, we want to design and build and customize things as per
Okay.
their needs in their home. And that also came from our sister, that we have built up certain things, for example, simple rods so that they don't fall, how they can be lifted and so on. So we are planning to get that imbibed as well by means of technology.
That's a
uh,
beautiful vision, really.
Correct.
We're
And
very
then the last thing is to expand our business to other cities and countries, which all of the business, how to
yeah,
scale forward
yeah,
and so
yeah.
on. That's
That's a
that's
beautiful. We wish Healthserve all the best, and I'm sure you're going to be
Thank
making
you.
great trends there for this industry. And I would really like to thank you for giving us such a wonderful thing. But before we go, I would just like to tell all the viewers, if you want to continue learning, and I hope this has been a huge value addition and an action-packed value addition, hot box for you for really getting so much of learning on doctors entrepreneurship coming from Dr. Shekhar. If you want to continue learning, you must join our Business Builders Masterclass for Doctorpreneurs, which is coming in November. Click on the link below and you're going to get a whole lot of gifts there at that webinar for you as doctors. So, Dr. Shekhar, before we say goodbye to our lovely viewers, I just have got to say that what is that one message that you want to give as a parting message to doctors who who are really not making it to entrepreneurship yet?
Yeah. I think if in one line I were to summarize my journey, I would say that stay passionate, stay focused, and take risks in life. These are the three things what I would
Beautiful,
like to say.
beautiful,
As
beautiful. With
one
that, I
message.
really have to say, yeah, thank you, Dr. Shekhar. Wishing Healthserve and you a very, very big best, all the best in everything that you do. And really thank you and making it a wonderful session today.
Thank you so much, Priscilla. Thanks for having me, and all the best to all your viewers. Thank you so much.
Thank you.